Practice makes perfect. Constructing a feasible and cost-effective cesarean section simulation. All right, in this video, we are going to walk through construction of the low-technology C-section simulation that our program here at University of Kentucky has used for many years to help orient our new interns. Many programs and educators, of course, create and use C-section simulations. We feel that our model is particularly easy to assemble, maintains a relatively high amount of fidelity for the low technology nature of the simulation, and all with an overall low cost. Let's start by talking about what you will need. Number 1, your fetus. 2, red EVA foam sheet for the uterus. 3, glue stick for the pubic symphysis. 4, sandwich bag for an optional bladder flap. 5, saran wrap for the peritoneum. 6, duct tape for structural support. 7, white EVA foam sheet for the fascia. 8, polyester fiber fill for the subcutaneous layer. 9, red felt to represent the rectus muscles. 10, skin tone felt for, you guessed it, skin. And last but not least, a plastic bin. We prefer the hospital variety for your abdominal cavity. Here is a brief summary of the estimated cost for supplies. And with that, let's get started.
Make your uterus. Create a template or use the one provided to cut the red foam sheets into the rough shape of a uterus. You would need 2 per model, one for the front and one for the back. Now that we have our 2 halves, it's time to assemble our uterus. Tape the 2 halves of the uterus together with duct tape, leaving the inferior edge, i.e. the cervical area, open. Once you have taped approximately 2/3 of the uterus, go ahead and insert your fetus. Once your fetus is in the desired position, tape the uterus the rest of the way.
Step 2, affix the uterus. Place your gravid uterus inside the plastic bin, aka the abdominal cavity. Next, tape the cervical edge of the uterus to the front wall of the plastic bin. It is important in this step to make sure that you tape the uterus very securely so that the learners can exteriorize the uterus after the baby is delivered.
Step 3, bladder flap. Similar to an actual surgical practice, you can choose to create a bladder flap. To do this, affix the Ziploc bag to the front of the uterus. The 2 layers of the bag represents the peritoneal reflection.
Step 4, create a pubic symphysis. To allow learners to practice using landmarks to plan their fan and steel incision, it is helpful to create a pubic symphysis. Here, we are using glue sticks from a hot glue gun, but really any rigid cylindrical item will work.
Step 5, peritoneum. Tear a large enough piece of saran wrap to cover the entire opening of the basin. Tape it in place. Again, taping securely helps to create tension and make it easier for learners to bluntly enter the peritoneum.
Step 6, rectus muscles. Take your red felt and cut a vertical line in the middle of the sheet, leaving some amount on both the superior and inferior aspects of the sheet intact in order to maintain stability of your rectus muscles. As shown, place the felt over the basin and tape in place.
Step 7, fascia. Use the thin white foam paper for this step. We often do a double layer to mimic the 2 layers of the fascia. but one can suffice. Place on top of the rectus muscles and over the basin to tape it in place.
Step 8. Subcutaneous tissues. Now cut the polyester fiber fill to size and place over the fascia. Next, tape into place.
Step 9. Skin. Last, but certainly not least, cover the entire basin with skin-colored felt and tape it into place.
And voila! Now it's time to have some fun and learn about cesarean deliveries.